Hi, I'm Sarah Riley, physical therapist in the Spine and Joint Institute at Bozeman Health. In this video, we'll be reviewing how to get in and out of bed after your total hip or total knee replacement. So we have three strategies for getting in and out of bed after total knee and total hip replacement, and we'll go over all of them in this video. Your physical therapist will work with you and figure out what's the best strategy for you. In general, it's easiest to get out of the bed on the side opposite your surgery. So for the purposes of this video, her surgery was on her right leg and we're exiting the bed on the left side. So in the first strategy, we're going to start scooting your legs towards the edge of the bed. Maybe one more time. Now I want you to push up to sitting. Yep, push up using your hands. And now start scooting and rotating, yep, towards the edge of the bed. And then get your feet to the floor. Perfect. So to get back into the bed is a similar strategy. I'm going to have you start to turn and rotate yourself so that you're more in line with your pillow. Perfect. Now I'm going to have you help lift this leg up into the bed. So that's your surgery leg. We're going to take extra attention and care. Now you bring up your non-surgery leg and use your hands to start scooting over to the center of the bed. And then you're going to lay down. All right, for strategy number 2, we're going to cross the surgery leg on top of the non-surgical leg. That way the non-surgical leg is supporting your surgery leg through the transfer. We don't typically recommend this strategy if you've had a total hip replacement with a posterior approach because it breaks the posterior hip precautions. Your physical therapist will work with you to find the correct strategy for you. So, for the purposes of this video, this is her surgery leg. We're going to put it on top of the non-surgical leg. Now you're going to come up into sitting, push up on your hands, and swing your legs to the side. And then scoot forwards and get your feet to the floor. Perfect. All right, so to get back into bed, you're going to pre-position your hips and start scooting towards, the pillow a little bit. Yeah. Now we're going to put your surgery leg on top of the non-surgical leg crossed at the ankles. And you're going to use a little bit of momentum and swing your legs up into the bed. And then you can use your arms to help push you into place. Lay down and uncross your legs. All right, so in this third strategy, we're using a leg lifting device. This is a great strategy for those of you who are having trouble getting your surgery leg in and out of the bed. The leg lifting device supports the leg during the transfer. So we're using a gait belt today, but you can also find a leg lifting device at any medical supply store. You could use a standard belt, or you can use a rolled up bed sheet to help support your leg when you're getting it in and out of the bed. All right, so I'm going to put our belt around her foot. Keep it nice and secure. She's going to hold on to this side of it and keep this belt nice and tight through the transfer. Now you're going to start to bring your legs towards the edge of the bed, keeping your knees nice and tight and straight. Push up onto your hands. And now keep moving your legs towards the edge of the bed, one at a time. Using the leg lifter to lift that leg. Good. And then you can scoot forwards and put your feet on the floor. Okay. All right. So when we're getting back in the bed, you're going to start to turn and scoot so that you're more in line with the pillow. Now you're going to use the leg lifter to lift your surgery leg into the bed. And now you're going to bring the non-surgery leg into the bed. Yep. Walk your legs over. Keeping tension on the belt. Perfect. And then you can lay down. Perfect. At Bozeman Health, our goal is to get you healthy and back to the activities you love.